Being a new graduate physical therapist is both exciting and terrifying. Gone are the textbook clinical cases reviewed in your ortho class, as well as the supportive guidance of your clinical instructor. It's just you and your patient. Oh, and did I mention that they're 15 minutes late for a 30-minute eval? And their body chart looks like this. So to ease your transition into clinical practice, we've compiled 4 keys for new graduate physical therapists. You are inevitably going to encounter the patient that will stare you dead in the eyes and tell you they have 10 out of 10 pain while they casually sip on their oversized Dunkin's coffee that has entirely too much cream in it. And despite you observing them lift 50 pounds overhead repeatedly, they continue to rate themselves as severely disabled on all outcome measures. And there is no manipulation or corrective exercise in the world that is going to get you out of this one. While we often think of orthopedic physical therapy as concerning primarily muscles, joints, and bones, it's important to remember that there is also a brain controlling all of it. The patient's thoughts, emotions, and mental state will inevitably influence their perception of pain and physical well-being. And addressing these psychological factors is just as crucial as treating their physical symptoms. Psychologically informed practice is something that does not get enough attention in school, but is invaluable in the world of orthopedic physical therapy. The sooner you begin to implement screening tools to detect psychological risk factors to persistent pain, the better. It will allow you to obtain a more accurate clinical picture and indicate the need for early, psychologically informed interventions, such as pain neuroscience education, graded exposure, and cognitive functional therapy, to name a few. In doing so, you will see your quality of care improve, as well as your patient's outcomes. There is no better way to help you navigate the labyrinth of patient care than a clinical mentor. This is not to say that your knowledge base gained through the years of PT school won't get you through the day, but your lack of experience is a significant handcuff when you face new challenges. There will be times when you are going to leave an evaluation room exclaiming, "What the just happened?" Studies have shown that new graduates who receive structured mentorship are happier, more confident, and have greater degrees of job satisfaction. Unfortunately, not all workplaces have established mentorship programs, and ones that do may be unstructured and of low value. Now, if you're really committed to advancing your skills, the best choice would be pursuing a residency. Residency training will ensure you receive top-notch mentorship from a specialist-level physical therapist, while also significantly enhancing your knowledge and skills in the field. But no matter what you do, finding a mentor early in your career is critical to your growth and sanity. And if your clinic doesn't have one, simply reach out. The physical therapy community is full of top-notch therapists who love to educate and would be happy to help. Of no surprise, patients who are more compliant with the prescribed exercises have better outcomes. Yet studies have shown that non-compliance with home exercises to be as high as 50 to 70%. Home exercise burden is part of the reason, with studies showing that those who are prescribed greater than 4 exercises are less compliant. So don't go giving your patients more of a reason to be non-compliant by handing them a binder of home exercises, because it's going straight into the trash along with their outcomes. Try to find the most relevant impairments and focus on those. Most of the time, the secondary stuff fixes itself, and if not, you can address them when the primary issues are resolved. There's an incredible number of orthopedic tests and measures that are at your disposal, and choosing what to look at can be an immense challenge in itself. You're going to feel the urge to look at the patient from top to bottom, bringing them through every objective measure and special test known to man. You may as well slap them with the latest version of Dattilo. While a comprehensive examination is a critical part to effective patient management, over-examining the patient can leave them with more pain than what they came in with, and they are likely not to come back. A way to minimize this from happening is by acquiring both the patient's level of pain severity and irritability. Now, you may think that this is overly simplistic, but many therapists only obtain pain severity and not irritability, which is an essential piece to guide the intensity of the examination and treatment. Irritability considers the amount and type of activity needed to both aggravate and ease symptoms. If a patient has severe pain with movement, but it is quick to resolve, then you may choose to perform more intensive or provocative testing, as you know their symptoms are short-lived. On the other hand, if a patient's symptoms are easily turned on and last hours after, you should avoid anything that is going to irritate their symptoms and go for more of an alleviating approach. So remember, instead of bursting into the room like the therapeutic version of Arnold Schwarzenegger and blowing up your patient, take the time to appreciate their pain severity and irritability to better gauge your examination and treatment intensity. Well, I hope you enjoyed this episode of Physio Show. If you did, give us a like and subscribe to the channel to help us continue to grow and provide you with more quality physical therapy related content.